In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. The investigation found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world, including Malaysia. In this video, I will share a quick look at what is currently known about COVID-19. Coronavirus is a large group of viruses. They consist of a core of genetic material surrounded by a lipid enveloped with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how this virus get their name. There are different types of coronavirus that cause illness in animals and humans. In humans, coronavirus can cause respiratory infections ranging from the common cold to more severe disease. So, where did this new virus come from? It's known that coronavirus circulate in a range of animals. Sometimes this virus can make the jump from animals to humans. This is called spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. How does the disease spread? The disease can spread from person to person through droplets. When an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects and when another person touches them and then touch their eyes, nose or mouth. What are the symptoms? The time taken from exposure to the virus and development of symptoms is on average 5 or 6 days, but can range from 1 until 14 days. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people report loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment, but there are some people who are at risk of serious illness. They include older people or people with underlying medical problems such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There is also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people and the appropriate use mask. It's important to stay home if you are feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. It's important to follow their advice. The vaccines to prevent COVID-19 are currently done and distributed around the world, including Malaysia. Scientists around the world are working hard to make this happen. My name is HAZIQ bin HASMADI, and that's all from me. Thank you.